If I was to get the vaccine, now this is either vaccine,
Yep.
AstraZeneca or Pfizer vaccine, are my platelet counts likely to drop?
Look, that's difficult to answer, to an individual. We do know that in following vaccinations, and most commonly following the measles, mumps, rubella vaccine, that's well known to trigger ITP. And we do have some data from the UK. So in the UK, 20 million, just over 20 million doses, first doses of the AstraZeneca vaccine have been given. And there have been 262 cases of thrombocytopenia reported out of those 20 million doses. Around the same time, they've given 11 million doses of Pfizer vaccine, and there are 61 cases of thrombocytopenia reported. So, those are small numbers compared with the number of people being vaccinated. What we don't know is whether people with pre-existing thrombocytopenia are more likely to get a drop. Obviously, if your platelet counts start lower and they drop, they may end up much lower than if you've had a normal platelet count. But really, the amount of information we've got through doesn't enable me to confidently predict. All I'd say is I think the risk of severe thrombocytopenia is not going to be a major issue, and generally speaking, we can manage exacerbations in ITP without too much trouble.
Wonderful. Okay, I've been in remission for a few years. Will the vaccine take me out of remission?
Well, I think it's difficult to say. Similar answer to the previous question, really, regarding drop in platelet count. So we do know that people who've been in remission with ITP for some years, certain things can trigger a relapse, things like pregnancy, acute viral infections, serious infections, and sometimes just the condition relapses without any clear precipitant. I think there is a risk. I think it would be a very small risk. I've mentioned in the previous answer, the rates of thrombocytopenia following vaccination, which are, a matter of a couple of hundred in 20 million. So I think the risk of really running into big trouble is pretty low.
Okay, I've had my first dose of the AstraZeneca vaccine and I was okay,
Yep.
but am I at a greater risk of blood clots with the second dose?
Look, I think the answer to this is a bit clearer than some of the many unknowns. Certainly the risk with AstraZeneca vaccine appears to be a first dose risk, and it's generally regarded that it should be safe to have the second dose if you've already received the first dose.
Okay, so I'm over 50 and obviously the Australian government has now earmarked for all over 50s to now start getting the vaccine and the AstraZeneca vaccine. But which vaccine as an ITP patient, if I'm over 50, should I be getting?
Look, it's a difficult one to answer because, as I understand it, at the moment people aren't being offered a choice. I believe the only people who are being offered a choice are actually the under 50s, who the government, based on recommendations from the Australian Technical Advisory Group for immunisation, they've recommended that people under 50 should be prioritised for the Pfizer vaccine. The problem, of course, is we don't have the supply of Pfizer vaccine in Australia. It's not manufactured here. Although that's the goal, there aren't those vaccines that can be given at the moment to cover all the people under 50. So really the only people with choice are those under 50 who can elect to have the AZ vaccine if they want to. That's going to be available now, and the government is fast-tracking delivery of vaccine beyond the 1B group, which was the sort of priority at the moment. So I'm afraid I don't think if you're over 50 you'll be offered a choice if you've not already been given the Pfizer vaccine as part of Group 1A, which are the frontline workers.
What's the risk of ITP in having the AstraZeneca vaccine?
Well, they're around in the UK, so that's where we've got the best data from so far. Around 262 cases of thrombocytopenia out of 20 million doses of AstraZeneca first dose vaccine given. So the risk is pretty small, and in fact it would be less than the usual background rate of new diagnosis we see in Australia, over the next few months anyway, I should suspect. So I think if we look at all ITP patients who are going to be diagnosed in the next 12 months, a minority of them would be caused by COVID vaccination. But How that pans out, I can't be definite at this time.
As an ITP patient, am I part of the 1B rollout of the vaccine?
Yes, so haematology patients have been included in the group known as 1B. So whether you've got a blood cancer or immune thrombocytopenia, doesn't matter, you're classified as a haematology patient and you are included in the 1B group.
You've already touched on this one, but
Yep.
as an under 50s,
Yep.
am I able to choose to get the Pfizer vaccine?
Well, you by default, the Pfizer vaccine will be offered to you. You can actually choose to have the AstraZeneca vaccine if you want to be vaccinated sooner. It's really a matter of supply. So the government, based on ATAGI recommendations, has stated that people under the age of 50 will be prioritised to receive, or recommended and prioritised for the Pfizer vaccine. But that vaccine's all made in UK, Europe, and we don't have supplies at the moment to roll out to people under 50. So you can choose, if you want to be vaccinated sooner, to have the AstraZeneca vaccine. You will be entitled to receive the Pfizer vaccine. That will obviously require a bit of waiting around. There's another vaccine that Australia's contracted to purchase called Novavax, which is a inactivated virus vaccine. What we do know is that the other inactivated virus vaccine, which is Sinovac, the Chinese vaccine, they don't have any reported cases, at least as far as I'm aware, of these rare clotting complications. So it may be that the Novavax would be an alternative to the Pfizer vaccine, but no date has been set yet for the Novavax to be released in Australia. It hasn't gone through the Australian Therapeutic Goods Administration approval process yet, so I can't give a time frame for that.
If I chose to, obviously as part of the 1B group, chose to get the vaccine, what's the best way of me getting that vaccine?
Well, at the moment, through your GP, if you contact your GP and identify yourself as a haematology patient, you should be able to arrange for a vaccine to be given. The government's planning to set up vaccination hubs. I don't have a time frame for that, but it's possible that that may be starting fairly soon. Again, I believe just because of the vaccine supply situation that people would be given the AstraZeneca vaccine in vaccination hubs. There may be a small amount of Pfizer vaccine available through hubs, but I can't be sure about that. And you know, there are ongoing supplies coming in, but the vast majority of vaccine held here at the moment and being manufactured, the only one being manufactured here, is the AstraZeneca vaccine.
So ITP patients, there's a lot of questions around, are we at risk of blood clotting?
Yeah.
So can you give us a little bit of insight into that?
Yeah, well, patients with ITP already have a slightly increased risk of clots compared with the general population. It's thought that the antibody that leads to platelet destruction and binds onto the cells in the marrow that make the platelets the megakaryocytes also causes platelet activation. So there's around about a 1.2 times risk of blood clots having ITP compared with the general population. And you know, having a low platelet count doesn't protect against those clots. So what we do know from the UK, so they've got around 150 patients now who've had this vaccine-induced thrombocytopenia thrombosis syndrome. And what we do know is that number doesn't seem to be enriched for patients who've had previous blood clots, thrombocytopenia, ITP, or you know, any other risk factor which in usual times would be associated with increased risk of clots. So this specific complication of the vaccine, which is known as VIT, it doesn't appear to be, the risk doesn't appear to be increased by previous clots, previous low platelet count, or anything else that we know of at this stage. There was a suggestion a couple of weeks ago when we were early on in this identification and reporting of this process that possibly young women may be more at risk. But as more information has come out of Europe and the UK, what we know is around a third of patients with this VIT complication are over the age of 50. The gender balance is absolutely neutral. So there doesn't seem, once more cases have been recognised, there don't seem to be an increased risk to young females. It's thought that initial reporting bias was caused by the 1A, if you like, in Australia group who are prioritised for vaccine were the frontline healthcare workers, and obviously nurses are included in that group, and the majority of nurses are young females. So in short, really, having ITP, as far as we are aware, both from reporting, albeit at very low numbers of cases, and from a sort of mechanistic point of view, we wouldn't expect people with ITP to be more at risk of this rare complication of the AZ vaccine.
Wonderful.